So this is Elizabeth, and we're going to talk about measuring for our telemetry strips. So in the hospital, of course, you'll be using the e-calipers, but while you're learning measurements, you're going to be doing it with paper and a pencil. You can, of course, use a pen, but we recommend a pencil in case you want to erase things. The first thing that we want to review is what it is that we're measuring. We have PR, we have QRS, we have QT. We'll be measuring the rate. We'll be talking about the ST segment. Now, a couple of things we don't exactly measure, but we do have some thoughts about our T waves and P waves, and so we'll get to those in a second. So if we remember, a PR is meant to be 0.12 to 0.20. Now I know that in practice we try hard not to keep things in our heads, but there are certain things like normal vital signs that have to live in our heads, and if we're telenurses, normal measurements are one of the things that we need to keep in our head. We don't want to keep having to go back to reference. Now a QRS needs to be less than 0.12. A QT for our purposes going to be less than or equal 0.45 for a normal. As you know, a normal rate would be 60 to 100. So look at how we're going to figure that out. Again, enough for our purposes. The monitor will always be more exact when it's figuring out the rate and when it's figuring out the QT. The ST segment we measure differently. We don't measure it horizontally. The ST segment we're talking about vertical height. Is it elevated or depressed? Now, T waves and P waves we don't actually measure. We just want to make sure that they look the same from impulse to impulse. And I know we try to shy away from the term normal in nursing, but in this case, that's really kind of what you're being asked is, does this T wave seem normal? Is it too tall? Is it peaked? Is it inverted or upside down? Not how big is the wave, just if it looks funny is mostly what you're looking for. So if we move from what our normals are and we move over to the strip, we're going to look at this strip here that is labeled strip number 4. Now this paper that I was just writing on, I'm now going to use this as my tool to help me measure. If I remember, every small box is 0.4 seconds. Every big box, the thick lines, is 0.2 seconds because there's 5 little boxes makes up a big box, right? So I see that I have a PR here. So I'm going to move my paper up here, and I'm going to mark my paper right at the beginning of the P wave, and then till right to the beginning of the QRS, because that is my PR interval. I'm going to take this measurement up here to somewhere I can read well, and I'm coming out with a PR on this that is right at about 0.20. I'm then going to go on and look at a QRS. I'm going to do the same thing. Now, measuring the QRS is really almost an academic discussion. The thing that you needed to know was, is your QRS wide or narrow? When you look at this QRS, you can already tell that it is narrow, which is really the only question you needed to answer. What you're doing then is deciding how narrow is it. I'm going to mark right where the end of the PR is and right where it comes back to the baseline. So you've got a Q, R, S, right? So I'm going to go back up here. I'm going to see what that comes out to be. I'm going to say that my QRS is 0.06. Again, all I needed to know was that it was narrow. What else did we say we were going to measure? We said we're going to have a look at the QT. I think that you will find in all of this that measuring the QT is the hardest because it involves counting more small boxes than anything else. Right at the beginning of my Q to the end of my T. Then I'm going to move that up here and see how many boxes that turns out to be. How convenient. It looks like it is 2 big boxes. So my QT I'm going to enter as 0.4. So we've got our PR, we've got our QRS, we've got our QT. Now, one of the other things that we mentioned we would be interested in is the rate. In order to figure out a rate off of a strip like this, you need 6 seconds. These hashes at the top are meant to denote 3 seconds. So there's 3 seconds and there's 6 seconds. Now, if we multiply 6 seconds by 10, we'll get 60 seconds, which of course is a minute, and we take heart rates per minute. So we will count all of the QRSs that fall within the 6-second strip. So I've got 1, 2, 3, 4, 5, 6, 7. So I would say that my rate is 70. Now, in real life, when you want to know somebody's heart rate, you're just going to look at the monitor and read the big green number, right? So this is an average or close enough for our purposes as far as the heart rate. There are many more complicated ways to figure out the heart rate, but there is no need. So we've got our PR, our QRS, our QT, our rate, and then we also wanted to talk about an ST segment. Now again, we have been measuring everything horizontally because we've been interested in time. The x-axis is time. How much time does it take for the impulse? Now we're going to look at amplitude or voltage, which is the y-axis, the vertical one. In order to see your QT, you find your PR, and you should be able to drive your pencil mark right into your ST segment. If it's more than 1 box above or below, you have variation in your ST segment. Now, when I was driving through right here, I've got about a half a box below. You can't make anything out of half a box. And I see this impulse, again, I can drive right from my PR across my QRS into my ST segment. So I would say that I have no elevation or depression. That's all I wanted to know. When we look at elevation or depression, we'd be looking at how many little boxes up or down is that depression, but I don't have any. Now, the other thing we said is we just want to have a look-see at our P waves and at our T waves. Now, when we're looking at P waves, we want to see that you have 1 to every QRS, and you want them to look pretty much the same from one to the next. Nobody's inverted, nobody is looking any particular way. So we have nothing to say except we have P waves and that they are 1 to 1 with the QRS, so we really needed to know. And T waves is really pretty much the same. Your T wave should always be shorter than your QRS, and it should be a nice little rounded hill like this. If your T wave is inverted, meaning it's going down instead of up, that would be something to note. But mostly T waves, I know we try not to be normal, but is your T wave normal? And the answer to that question would be yes. Yes, it is. The more T waves you see, the more comfortable you become talking about having a problem. And I think that is all we have to say about measuring with paper. We are just going to briefly do kind of the same thing, but with a caliper in case you have some. If you don't have a caliper, they are not required. Please just use the paper method. It's what I spent most of my life using, is the paper. If you happen to have calipers, there are got little pencil points on the end. So you can do those same measurements from the beginning of my P to the beginning of my QRS. And then I take it up here and I see what I get, and I get the same measure. I get about a 0.2 for my PR. For my QRS, from where it leaves the baseline to where it returns to the baseline. And once again, I'm getting about a 0.06. QT, from the beginning of the QRS to the end of the T. Then we go up here and we measure. We're getting about a 0.40. And then the rates, you don't need calipers for rates. It is the 6 seconds, right? You need 1, 2, 3 hash marks, and whatever falls in those hash marks. And you don't need calipers to determine P waves and T waves because you're just kind of eyeballing those things. And I think that concludes our measurement video.